of the Presidential Taskforce on COVID-19, distinguished ladies and gentlemen of the press. These are very difficult times and they're very hard times, but my confidence is born out of the Nigerian spirit that we would overcome even these times. I am pleased to lead members of the Presidential Task Force on the control of COVID-19 pandemic to brief the leadership of this distinguished Senate and the House of Representatives on the efforts being made to fight the coronavirus in Nigeria and to mollify its impact. Distinguished senators and honorable members, Your Excellencies, the world is in the midst of an unprecedented catastrophic crisis because the coronavirus, COVID-19, is most significant public health emergency of international concern of our generation. It has spread across 209 countries and territories around the world with a reported infection of about 1.5 million as of today, confirmed cases worldwide, and about 87,000 deaths, with about 236,000 people who have recovered from the disease as of 8th April 2020. The disease has placed considerable and significant strain on the global healthcare system and the economy of the world. Although the disease started in China and spread rapidly across Europe and the Americas, today many African countries are beginning to see a rapid rise in the number of cases. Currently, 52 African countries are now affected with the disease, reporting over 10,600 cases, 533 deaths, and given the relentless exponential growth rate witnessed in other countries, the spread of the virus in the continent and in particular in Nigeria should be expected to rise. As of 9 p.m. on Wednesday, 8th April 2020, there were 276 recorded cases, with 6 deaths in Nigeria, with the spread reaching nearly half of the states of the Federation. Lagos, our economic heartbeat, is the epicenter with 145 cases, more than half of the total infections in Nigeria. Globally, countries with more advanced and sophisticated health systems than ours are struggling to deal with the cases in their own lands. We can be under no illusion that the case affects all of us, and it is on all of us to play our part in solving this. Since the inauguration of the Presidential Task Force on COVID-19, and with the full support of His Excellency President Muhammadu Buhari, the task force has recorded a number of achievements. It has established a high-level political and multi-sectoral coordination mechanism for preparedness and response to the COVID-19 pandemic, with consequent improvement in the following. First, interministerial and interagency coordination and collaboration across all areas of the pandemic response. Development of a national multi-sectoral pandemic response plan and engagement of all MDAs and extra-ministerial departments in the response. High-level coordination of the United Nations agencies and bilateral and multilateral partners, foundations and international bodies involved in the response, resulting in 1, United Nations Basket Fund, 2, accelerated procurement systems for goods and services, 3, attraction of donations from global philanthropies, including what we receive from JACMA, corporate bodies operating in Nigeria, etc. and high-level engagement with the organized private sector with better coordination of their core competencies and expertise. Just what the distinguished Senate President referred to. We have the COVID CBN COVID-19 Response Fund, and we have the NNPC and its partners. We've also engaged with the Nigerian Economic Summit Group. Mobilization of states and local government area resources in preparation for the possible spread of the disease into communities. We have conducted state needs assessment and state of preparedness of all our subnational governments. We've also stimulated economic national interest to mitigate the negative impact of the pandemic, e.g., engagement of the local manufacturers across board for the stimulation of local production of essential commodities to reduce dependence of imported commodities. We believe strongly that in spite of the adversity, we can still make gains in getting our industries engaged in the production of essential commodities for fighting the coronavirus. Local production of face masks, hand sanitizers, and protective gears are all in the process. We have also critically reviewed the state of our health systems in the focus states and the FCT and all the states of the Federation. We have also participated in the identification of available capacities for isolation and treatment of the COVID-19 patients, which has yielded over 1,000 bed spaces across all facilities. We've improved surveillance systems. We have also involved in the acquisition of intelligence data to guide strategic policy formulation and implementation of control measures, such as may emanate from restrictions and or lockdowns of parts or all of the states. The strategy adopted by the Presidential Taskforce, working in conjunction with states, include testing, detection, isolation, contact tracing, and management. This strategy has resulted in the following measures, which you are already aware of. These are: 1, restriction of travel to and fro 15 burdened countries worldwide; 2, closure of the land, sea, and air points of entry; 3, restriction of movements in Lagos, Ogun, and the Federal Capital Territory by the President, and by extension, restriction in invariably most of the states as imposed by the state governors. The introduction of social distancing and personal hygiene policies, increased number of molecular laboratories from 5 to 9, and this would rise to 11 by tomorrow, Friday, 10th April 2020. When we started, we had only 5, but we're hoping that by tomorrow, we'll have an additional one that will make it, would have added 6 testing laboratories to the ones that are in existence now. And 6, expansion of the national capacity for testing. We're trusting that it will be expanded from 500 samples per day to about 1,500 per day. 7, trained medical and healthcare personnel in the management of infectious diseases across the state and the services. We want to equip our first responders, those that are in the line of duty, our nurses, our attendants, because dealing with infectious diseases is not just dealing with any other disease. With particular reference to the restrictions, number of cases recorded show that Lagos and Abuja have become the high burden areas in Nigeria, and that drastic measures were required as part of the containment strategy to prevent community transmission. The reason for the prevalence was attributable to the fact that both cities are major points of entry. Also, records show that a higher percentage of the cases, including the index case, were imported. The creation of awareness using all mediums continued to be accorded top priority under the non-pharmaceutical approach for combating the pandemic, because the development of a vaccine for its treatment is still a long way ahead. The pandemic has provided a unique opportunity to X-ray the state of the national healthcare systems, which is in dire need of reforms and funding. The weaknesses in our health systems became more glaring given the way more established health systems in Europe and America collapsed under the pressure. The plan, therefore, is to lay a legacy foundation for immediate, medium, and long-term development of the health system. To this end, the PTF has proposed to utilize the resources being mobilized in the following strategic manner. 1, direct development and delivery of critical infrastructure to the states by the donors. Direct procurement, donors. Direct procurement and delivery of the PPEs, and other critical equipment by the donors. Deployment of rapid response teams to states for capacity building and support. Expansion of the testing capacity in the country. For transparency and accountability, therefore, the PTF would not be directly involved in the collection and disbursement of cash donations for COVID-19. The Accountant General of the Federation has already published the account details for collection through some commercial banks and also provided the modalities for its utilization. Along the same vein as spoken by the Senate President, there should be a collection point, and disbursement will be guided by the financial regulations and other extant rules that should be put in place. All main COVID-19 accounts shall be domiciled in the Central Bank of Nigeria. However, all non-cash donations shall be duly received by the PTF, acknowledged, documented, and appropriately deployed. Distinguished senators and honorable members, Your Excellencies, I mentioned earlier that COVID-19 pandemic has stolen our health and our wealth. The impact of this is not only on the national economy, but on the poor, the aged, the sick, and the vulnerable. Out of concern for these categories of persons, His Excellency President Muhammad Buhari set the following actions in motion. Set up a team headed by the Minister of Finance to examine the impact on the economy by COVID-19. He also went ahead to set up an economic sustainability committee headed by His Excellency the Vice President. He approved a stimulus package of over 500 billion, which is awaiting consideration by the National Assembly. He authorized the employment of 774,000 Nigerians across the 774 local governments in the country. He authorized the payment of conditional cash transfer under the Social Safety Net program, which His Excellency, the Speaker of the House of Representatives just alluded to. He authorized that the school feeding program should continue, notwithstanding the closure of schools, so as not to lose the nutritional essence of the program. He also authorized the release of 70,000 metric tons of grains from the National Strategic Reserve for distribution to first Lagos, Ogun, and FCT, as well as all the states of the Federation in different segments. He authorized the Nigerian Customs Service to release over 150 trucks of seized rice and other commodities for distribution along established patterns. He has also authorized other palliatives for the state, in addition to what the states are also doing within the province of their jurisdiction. Our nation, Your Excellencies, is at war against a very dangerous, unseen, and ubiquitous enemy, and all hands must be on deck to successfully prosecute the war. In addition, to providing the kind of leadership already demonstrated by the National Assembly. I find it very, very appropriate to remind you that your time and your positions is unique in our history, and it will require some major legislative action. I will mention a few, though not exhaustive. One, this National Assembly should develop a legislative framework to prepare Nigeria for any future pandemic. Two, develop a legislative framework for reforming and transforming our healthcare systems. I can tell you for sure, I never knew that our entire healthcare infrastructure was in the state in which it is until I was appointed to do this work. Our infrastructure, health infrastructure, is in the most deplorable state. If countries in Western Europe, America, can be overwhelmed by the COVID-19, my prayer is that we don't get to that stage. We do not have an infrastructure that can carry that battle. Three, strengthen the legislative framework for economic growth through domestic manufacturing. And four, deepen the legislative oversight during this pandemic and beyond. Pass legislation, and five, pass legislations that will further ease the ability of the executive to cushion the impact of the economic decline. And six, be part of community mobilization and enlightenment efforts. You are the representatives of the people. If you go back home and speak to the people about the need to stay at home, about the need to maintain social distancing, about the need for personal hygiene, they are more inclined to listen to you than just a broadcast. So that responsibility squarely is for you, our leaders in the National Assembly, to mobilize the communities and ensure that they adhere to the advisories that come out of our health agencies and WHO. Distinguished Senators, honorable members, Your Excellencies, I shall now, by your permission, invite the Honorable Minister of Health, the Director General of the Nigerian Center for Disease Control, and the National Coordinator of the PTF to provide some technical details, if you so wish to have those technical details. I want to thank you, sirs, for your kind attention and for this audience.